Dear colleagues, welcome to my hospital at Ranaghat, West Bengal, India. In this case, we can see there's an area in the nucleus where we can see shining crystals that look like diamond particles. I've taken up this case for surgery after a thorough wash of the ocular surface with betadine, that is povidone iodine 5% lotion, and BSS. The main incision is made at around 10:30 o'clock. And now this is a 2.8 millimeter incision on the posterior aspect of the limbus. This is a side port at around 8 o'clock. And now this is another side port at around 1:30 o'clock. I want to stain the capsule with trypan blue dye to show Capsulorhexis with needle, with 26 gauge bend needle. Stain the dye nicely and then wash the dye with BSS and then inject viscoelastic substance. This is 2% hydroxypropyl methyl cellulose. It is sprayed over the corneal epithelium. It improves visibility. This is an air bubble over the corneal epithelium. It must be removed. And now, see Capsulorhexis with needle. What you do is introduce the needle through the side port. I like to go through the side port. Incise the capsule and raise a big flap. Now flip this flap. That means the posterior surface is now facing the corneal endothelium, and guide this flap all around. Remain at a certain distance away from the margin of the pupil and do the Rhexis in this way. And this is a fairly round Rhexis. Most of the cases we can do Rhexis with the needle itself, but we must learn how to use Utata forceps, because in intumescent cataracts, in hypermature Morgagnian cataract, where there is no support in hypermature cataract, this Utata forceps is very much essential. Now in this case, hydrodissection has been done, hydrodelineation also has been done. Hydrodelineation has produced a beautiful golden ring, viscoelastic substance is injected, and now is the time to introduce the phaco handpiece. This is Oatley Cataracts 3 phacoemulsion. This is a totally unedited surgery. You are going to watch each and every step of the surgery. Consider it live surgery. Now here it is. Go bevel down and remove some superficial lens matter. Rotate, and this is, you can see, Cartwheel technique. The nucleus rotates and it comes off. The last portion just tumbled and came off. This Cartwheel technique is very safe, very swift in soft cataracts. Other techniques like divide and conquer, stop and chop may work, but it takes very long time and there is always a risk of catching the posterior capsule. Inject some visco and remove the cortex. You can use bimanual irrigation aspiration. In this case, I am using a 23 gauge Simcoe cannula. I attach these with a 10 cc glass syringe, and I like this instrument. It saves a lot of time. So cortex is cleaned. Posterior capsule is polished. And now is the time to implant an intraocular lens. In such cases, we can always do hydroimplantation, keeping the antechamber formed with hydro, that is PSS, and implant a foldable intraocular lens. The cartridge that has been used for this implantation is from Abbott, which is a 2.2 mm compatible cartridge. It is very good for implantation of hydrophilic lenses also. And now the side ports are closed by hydrating the stroma on either side of the stab wounds. And then a final lavage with Simcoe is done. I leave the antechamber very clean, very shiny and gluteus. After forming the antechamber, always check the wounds with a cotton-tipped Johnson bar. There should not be any leakage from any side. That's it. Thank you very much for watching. Hope this video will help you in developing your surgical skills. Be better and do better.